Hi, my name's Andrea Steele. I'm the facilitator for HLTEN 606, which is Client Assessment. This is my storyboard showing you the design of my e-resource, which I'm going to be developing for this unit. And I've decided to use what we call a decision-making tree as my e-resource and use it and upload it into Moodle. In Moodle, we can develop a decision-making tree using a lesson plan, which is located in the Moodle shell. So, for my decision-making tree design, these types of learning resources can be used in order to present the students with a case study or a case scenario, and then giving them multiple options as the tree grows wider and wider, in the sense the questions become greater or more in depth, and to a point where the students are choosing consequence, be it good or bad, in order to get a result or an answer to move on to the next step. So what I've decided to use in order to show you my design, I've decided to use the sticky notes on the computer to depict how my design will formulate within the Moodle shell. So what I've done, basically got a heap of sticky notes up here, and in hindsight I'll have a lot more as the tree progresses down and as the patient's condition changes and the students make other choices. But for the point of showing you on my storyboard, I've started off with these. So at the top, the first sticky note I've got is basically the top of the tree, and which is my case scenario, which gives an outline of the patient, their condition, and what they're here for. So then the students will read through that and then be guided by being able to choose an option A or B, be it primary survey or secondary survey. And then once they click on either one of those, it will take them to another decision, and each one will provide the students with some data, maybe some information on the client's condition, whether they're improving or deteriorating. It might provide them with some information about what sort of assessments they might need to do, what nursing interventions they might need to apply, and what ongoing medical management they may need to consider in managing this client. So, and as they progress through the tree, obviously there'll be more and more choices for them to choose from. And so whether they choose a good outcome or a bad outcome will depend on the result of their assessment and what interventions they put in place as to what steps it will follow on from there. But ultimately we would hope that the students would choose the best options and have the best outcome for the patients. So I think this flow on will work really well. It's going to provide the students improve their knowledge basis and their skill basis as far as medical conditions, signs and symptoms, and the nursing management and interventions required, but it's also going to improve their ability to think critically when they're assessing clients and managing clients for their future practice. So in order to follow on from this, I've decided that this e-resource will be their learning content. And so once they've worked through the decision-making tree in the Moodle shell, then they will be able to move on to a short quiz that will be followed after that, and they'll have roughly about 10 or 15 questions which they'll have to go in and answer. And those questions will be related to the case study, and it's more about seeing how much the students have taken in as far as their knowledge, what knowledge they've actually already got, and it's basically reinforcing what they've learned in the decision-making tree process through completing the quiz. I'll make another screencast video once I've got it set up in the Moodle shell, and I'll post that for everybody to see the final development from that. But that's all from me now, and thanks for your time and attention. Have a good day. Bye.